Welcome everyone to another wonderful episode here at Jaws Podiatry. We have, we're going to go ahead and present an upcoming case. This is a very young patient who has presented to our office with two major chief complaints. Complaint number one, the bilateral bunions left and right. And number two, the second digit, we'll call them crooked toes. You know, the patient, when we first started the conversation, the patient, immediately started talking about how she's been battling, she's not happy with the appearance of her feet. This is something that has, I guess, been, you've been thinking about years, right? Many years. And people don't really talk about this. Again, I've said it before over dinner, right? This is not something that people talk about. Here, take a look at my, my crooked toes. It's not, this is not something that a lot of people do. So, we do understand those elements. We would say, and we were also talking about it, that we would say like 70% of the patients that come see us here at Jaws Podiatry, they're coming for, more of the aesthetic elements, which clearly, can affect, people's self-esteem, the level of embarrassment, I used to say, oh, we live in Miami, we live in a place where people love to use sandals, but it's really not even like that. People from all over the world, come to see us here because they just don't like the appearance of their feet, period, whether they use sandals or not. But let's go ahead and present the case. Okay, so, this patient is 31 years old. She's extremely active, and, she's just, and the reason why I say that is because it's really important when we talk about, when is the right time, right, to have foot surgery or minimally invasive foot surgery. There's never a great time, and that's just a fact, right? This individual's a fitness instructor, and you guys can just imagine, right, trying to take some time off. It's not going to be easy, and that's one of the we were talking about the the pros and cons, open traditional versus minimally invasive. That's one of the great things about MIS, that we're able to get patients back to their daily life activities faster, right? So again, we can clearly see patient has bilateral bunions. Part of the problem is that the toe, right, the two toes are deviating laterally. They're kind of moving this way, and they will continue to do so because bunions are structural and biomechanical abnormalities. And that's probably, I'm not saying it's the only contributory factor to why the second toe is crooked. Again, right? Recently we presented a case kind of similar to this one. But the goal of this entire case is basically to, to remove, okay, we take this out, boom, and then we straighten out the toe. That's procedure number one, correction bilateral bunions using minimally invasive techniques. Now that will, let's just move the great toe a little bit. And now you guys can really appreciate the second digit deformity, okay? This is called an angular deformity, transverse deviation, right? Transverse this way. And, the toe is actually straight up until this joint here. There's one little joint, and then in that little joint, that's where we see that the toe deviates, this way. There's a saying that the nail never lies. Wherever the nail is looking, that's where the toe is actually, looking towards. In this particular case, it would be probably 1 o'clock, right? Depend on, looking, from this way to this way. So the idea is obviously, to straighten the toe. And the same thing goes for here, right? I'm putting my finger here to give it some leverage, and then kind of like that, okay? And again, this all these procedures are performed through one tiny little stitch here, one here, one here, and then one here. Call it the trifecta approach. This patient is going to be extremely happy. We were talking for, you can have a seat. We were talking for a very long time. I continue to say it, just because it's minimally invasive, it doesn't mean that it's a walk in the park. No, this is, this is serious. So for all the people that have enjoyed this video, that are interested in possibly reaching out to us, there's a link at the top. You know, you guys can definitely click on that, and that will direct you into the questionnaire and how to go about, you know, getting directly in touch with us. For non-subscribers, subscribe. Any questions, please, without a doubt, just, you know, I love to answer all questions to the best of my abilities. And, you know, we'll continue to do what we do. We're going to continue to educate the world one toe and one foot at a time. As always, have a nice day.